Morning, all. So today we're going to talk about bone tissue. And this is getting into the first, substantial chapter or system of the body. Before we get into bone tissue, this is actually going to segue into the skeletal system, which will include, the axial skeleton, which is sort of your trunk, and the appendicular skeleton, which is your appendages. And it's essentially, your bones. So when we look at the functions of the skeletal system, the primary functions of the skeletal system is support, storage of minerals and lipids, blood cell production, which is extremely important, protection, and leverage. And protection actually has twofold. One with the production of the white blood cells, which falls under blood cell production, but also physical protection of some of the vital organs of the body. So, sorry, I thought I actually had slides for each one of these. So for support, this is actual physical support of the human body itself. This actually gives shape to the human body. It also allows for muscle attachments. These muscle attachments will allow for the muscles to actually pull on something to create movements. Storage of minerals and lipids. You'll see that calcium phosphate is a major mineral that is stored within bones. Most people think that if you were to ask them why is calcium important for the body, they would say for bones. And although that is a very important component of what calcium is used for, as we go through this course, what you will start to see is that calcium is a very major signaling molecule that is used by the nervous system, by the muscular system. It's also used, for example, in blood clotting. So it is a very important mineral that is actually used physiologically a lot. And if, for example, your blood calcium levels are actually too low, what will happen is under hormonal secretion, you will actually break down bone tissue to put more calcium into the blood. Yellow bone marrow, this is where we can store fat. So we do have some fat storage within our bones. Blood cell production, all blood cells, this includes red blood cells, platelets, and white blood cells, are produced from the same stem cell within the bone marrow. Protection I mentioned a few minutes ago, the production of the white blood cells, which is very important for our immune system, but also the physical protection of the, for example, the thoracic cage and protecting the heart and lungs, the cranium for protecting the brain, vertebral column for protecting the spinal cord, and then leverage. This is allowing the muscles to actually pull on something. So bones are classified by their shape and their structure, okay? If we look at bone shapes, we have sutural, irregular, short, flat, long, sesamoid, and we can look at these here. Sutural bones typically are found in the cranium, and sutural bones are what I like to call gap fillers. If you have an area, for example, where two bones meet, but then, for an area that they aren't meeting, a sutural bone can sort of fill in there. We see these very commonly along the sutures, which are the connection points between the cranial plates. An irregular bone is just an irregularly shaped bone. Example, that would be the vertebrae. Short bones, these are like short cube-like bones. These are the ones we typically find in the wrist, which are our carpal bones, or the ankle, which are our tarsal bones. Flat bones, these are thin, parallel surfaces. We'll see these in the cranium. You have several flat bones that actually encase what we refer to as the cranium there. Long bones, this one's pretty self-explanatory. They're just long. And then you have a sesamoid bone, which is sort of a rounded structure. Okay, the patella would be an example of that. So, they're sort of defined here. When I was in college, we didn't call them sutural bones. They actually were called Wormian bones. But I've finally gotten that term out of my head for the most part, and we'll probably use sutural bones when I talk about them. But these are small, flat, irregular shaped bones. They are typically between flat bones of the skull. The number can vary among individuals. Your irregular bones, these are complex shapes. And as I mentioned, that could be vertebrae or the pelvic bones. Okay, this is looking at these guys again. Short bones, these are boxy. And again, carpal or tarsal bones, which are your wrist and ankle bones. And then flat bones, these are thin with parallel surfaces. We find this in the bones of the skull roof. The sternum is the flat bone, which is your breastbone, your ribs, and the scapula. Scapula is your shoulder blade. And here you can see some short bones again, and the flat bones. Long bones, these are long and slender. They are found in the arms, legs, palms, soles, fingers, and toes. And then the sesamoid bones, these are usually small, round, and flat. They will develop with tendons near joints of knees, hands, and feet. The location and the number can vary between individuals. For example, the patella. Here's an example of a long bone, okay, and then the sesamoid bone. Now, bones will actually have many markings or surface features. And the purpose of these markings is they will either act as a projection where muscles, tendons, ligaments can attach to. These projections could also be a point of articulation with other bones. You can also have openings and depressions. This is for the passage of blood vessels and nerves. If you have a blood vessel that needs to pass through the structure of a bone, you need to have an opening there. Okay. And we can see some of these projections or openings. A process is a projection or a bump. Ramus, this is part of a bone that forms an angle with the rest of the structure. Sinuses, these are chambers that are usually within a bone, and they're usually filled with air. We have 5 sinuses that are actually present throughout the cranium, okay? And unfortunately, if you're one of the lucky ones, sometimes those open air-filled chambers can get infected, and you get a lot of pressure buildup within those sinuses. A foramen, this is a rounded passageway for blood vessels and or nerves to pass through. A fissure, this is a deep furrow, cleft, or slit. A meatus, this is a passage or channel, especially the opening of a canal. And then a canal is an actual duct or channel. Here are some others, looking at different types of depressions, projections. For example, you'll see some of these terms throughout. Sulcus is a narrow groove where you can actually maybe have a blood vessel or nerve present there. A fossa is a shallow depression. Then we have to actually describe different parts of the bone, such as spine, crest, line. Tuberosity is usually a rough projection, very great for muscle attachment. For example, that one that you're looking at right there on the humerus, that is what we call the deltoid tuberosity, and that's going to be a point of attachment for the deltoid muscle. If you look at some of the long bones, we have what's referred to as the head. That's usually what's going to anchor into the joint. The head usually will have a neck, which is a narrow connection between the long part of the bone. And you will talk about this when we get to the bones, but most long bones will have what's called an epiphysis, which are the ends, and the diaphysis, which is the long part of the bone. Condyles, these are smooth, rounded, articular processes. That's what's actually going to articulate with another bone. Okay. So when you look at a long bone, again, the diaphysis, this is the shaft or the long part of the bone. This is typically composed of compact bone. And the central space is called the medullary cavity, where you'll find bone marrow. The epiphysis, this is the wide part at each end. It's mostly composed of spongy bone or trabecular bone. And then you have the metaphysis. This is where the diaphysis and the epiphysis meet. Also, and we'll talk about this a little bit later, you have what's referred to as the epiphyseal line, which is going to be the growth line for long bones. Eventually, those will close up. But here's looking at a depiction of the structure of a long bone there. Structures of flat bones. This is going to consist of spongy bone between two layers of compact bone. So it's sort of like a little bit of a sandwich there. And the spongy bone layer is actually called diploid. And here you can see we have a layer of compact bone right here. Then you have the spongy bone and then a layer of compact bone. Now, in class, I would often ask my students, what do you think is stronger, compact bone or the spongy bone here? And the answer is actually the spongy bone, because of the honeycomb structure. That actually provides a lot more support, from impact than, say, compact bone, which can crack very easily. Okay, bone tissue. We covered chapter 4, which was the tissues, and bone was actually part of that osseous tissue. Bone tissue is dense, supportive, connective tissue. It does contain specialized cells. It also has an extracellular matrix, which, if you remember, all connective tissue has a matrix that has lots of collagen fibers, and it's a solid matrix. The dense matrix is actually due to the deposits of calcium salts, and the bone cells, which are osteocytes, these are located within the lacuna, which are organized around blood vessels. Caniculi, these are narrow passageways that allow for the exchange of nutrients, waste, and gases within, this tissue. And then finally, the periosteum, this is going to cover the outer surfaces of bones except at joints. It consists of outer fibrous and inner cellular layers. The bone matrix is going to be composed of calcium phosphate, which makes up almost 2/3 of the bone mass. This will interact with calcium hydroxide to form crystals of hydroxyapatite, or what we typically find as the mineral bone. This hydroxyapatite will also incorporate other calcium salts, such as calcium carbonate and other types of ions, such as magnesium phosphate, to name another. A bone that is lacking a calcified matrix looks normal, but it is very flexible and does not have that very rigid support. The matrix proteins, about 1/3 of the bone mass is actually collagen fibers. And if you remember from the tissues lecture, the collagen fibers actually add a lot of support to the bone itself, the bone tissue. The bone cells, they make up only 2% of the bone mass, and there are 4 types of cells: osteogenic cells, osteoblasts, osteocytes, and osteoclast. Now, that these are actually going to all 4 of these will be choices of multiple choice questions. but they all look the same, all right? And what you have is, osteo is referring to bone, okay? And then we have our osteogenic cells, blastocytes, and clast, okay? And we'll define what each of these is. The osteogenic cells, these are the stem cells, okay? And they will divide and they will produce what are called osteoblasts. An osteoblast is an immature bone cell, but it's also a cell that's actually secreting extracellular matrix. Osteocytes, these are mature bone cells. They are found within the lacuna, and they are, like I said, these are mature bone cells at this point. Finally, the osteoclast, these are multinucleated cells, and they will actually secrete acids and enzymes that will dissolve bone matrix. So osteoclast activity is going to be very important when you are repairing bone, when you are remodeling bone, or even if you need to break down bone to release more calcium into the body. Osteogenic cells are, again, these are going to be those stem cells, okay? These are mesenchymal cells, which means, they're those stem cells. They will divide to produce osteoblast. That is located in the intercellular layer, the periosteum and the endosteum. That's where you would find these cells. And they also help to assist in any breaks, repair to the bone tissue. Osteoblasts, as I said, these are immature cells that produce new bone matrix during osteogenesis, which is the process of bone formation. Osteoid is the matrix that's produced by the osteoblast and has not yet become calcified. The matrix will have to become calcified during bone formation. Osteoblasts are surrounded by bone matrix, and eventually, once they sort of box themselves into these lacuna, they will become osteocytes. They will mature into an osteocyte. The osteocytes, again, these are mature bone cells. They no longer divide. They live in lacuna between the layers of the matrix. Their main functions is to help maintain protein and mineral content of the matrix. And they help to repair damaged bone. And then the osteoclast, these are going to absorb and remove bone matrix. They are large multinucleated cells. They will secrete acids and protein digesting enzymes, such as dissolving the bone matrix and releasing the stored minerals, such as I mentioned, to release calcium, but it could also be to even release magnesium. This osteolysis is important in homeostasis, and it's derived from the same stem cells that produce the monocytes and the macrophages. Now, looking at the basic structure of bone, we have what's referred to as an osteon. Osteon is the functional unit of compact bone. You're going to have a central canal where blood vessels are found. You'll have perforating canals. These are perpendicular to the surface of the bone, and they will carry blood vessels into deep bone and marrow. And then the lamella, these are layers of bone matrix. And these are actually going to form those concentric rings that you saw when you were actually looking at the bone tissue. And here you can see, this would actually be an osteon right here. And you can sort of see these concentric rings. You can see the central canal right here where you have the blood vessels. And these little tiny specks here, these are actually the lacuna. And these are where you're actually having to find the osteocyte cells. Looking at this a little more in a cartoonish version, here you can see an osteon where you have these concentric rings of these compact bone surrounding a central canal. Here's one of those perforating canals. Again, when I was in college, this had a different name. They were called Volkmann's canals, but now they're going with the perforating canal terminology here. So dating myself a little bit here. And you can see that compact bone is formed with these osteons sort of all sort of lined up next to each other here. Okay, this is actually spongy bone. We'll talk about that in a second. Now, spongy bone, this will actually lack osteons. The matrix forms an open network of trabeculae. This will lack capillaries and venules. Red bone marrow will fill the space between the trabeculae. This forms the red blood cells. The red bone marrow does. Again, when we say forms red blood cells, we mean it forms all red blood cells, all white blood cells, and all platelets. The red marrow will also contain blood vessels that supply nutrients to the osteocytes by diffusion. The yellow bone marrow, this is found in other sites of spongy bone, and this is yellow bone marrow is essentially fat. So here you can see we have compact bone here, we have compact bone here, but we have some spongy bone in this area right here. And as I mentioned, the spongy bone is actually going to give you a lot more support. And if you think of this area of the bone, say if this is your femur, this is in your hip socket here, this is really a high pressure point in this area here. And here you can see the structure of the spongy bone. So with your weight-bearing bones, such as the femur, the trabeculae and the epiphysis of the femur transfer forces from the pelvis to the compact bone of the femoral shaft. What will happen is this will cause tension on the lateral side, and the medial side of the bone typically will compress a little. So the force is going to come down here. This side will compress. The tension is going to end up on this side a little bit. The periosteum, this is a membrane that covers the outside of bones. You're going to find periosteum on all bone structures except within the joint cavities. This is essentially an outer fibrous layer. It's connective tissue that has an inner cellular layer. The fibers are interwoven with those of tendons. And then you have perforating fibers. These are fibers that become incorporated into the bone tissue, and what this does is it helps to increase the strength of the attachments. The periosteum will function to isolate bone from the surrounding tissues. It also provides a route for blood vessels and nerves to enter into the bone tissue, and it helps in participation of the bone growth and repair, mainly because you're going to find osteoblasts and osteoclast cells present in the periosteum. And if you look here, this is just that outer covering that we find on the bone here. Okay. Endosteum. This is going to be the lining within the medullary canal of bone. Then the endosteum is active during bone growth, repair, and remodeling. It covers the trabeculae of spongy bone, lines the central canals of compact bone, and consists of flattened layer of osteogenic cells. And if you look here, this would be the endosteum layer. By the way, anytime you see the term peri is going to refer to the outer layer, and anytime you see the word endo, that is going to refer to the inside lining. Okay. You might also see, instead of peri, epi. Epi also refers to the outside. And that's going to be a consistent thing that you'll see throughout the course, those prefixes that are used. Okay, so bone development. Osteogenesis is the process of bone formation, or another way to term for this is ossification. Calcification, this is the deposition of calcium salts. This is a process that actually occurs during ossification. There are two types of ossification. There's endochondral ossification and intramembranous ossification. And we're going to distinguish between the two in a second. Some human bones will not completely finish ossification until about the age of 25. So looking at endochondral ossification, this is how most bones actually form. You're going to develop a primary ossification center, which will develop inside a hyaline cartilage. The cartilage will then be broken down. This cartilage model will be broken down and replaced by bone. And there are 7 main steps involved in this process here. And they're sort of listed here, okay? And I believe on the lecture exercise that you guys will be doing for this chapter, I actually have you mapping out these 7 steps. So I would expect to see, this will be, maybe, an open-ended question on a exam, the 7 steps involved. So, it's an important concept here. But looking at these 7 steps, as the cartilage enlarges, okay, what's going to happen is you're going to develop a, within the cartilage model here, an ossification center, okay? And this ossification center is going to be a few cells that are going to sort of start to develop bone within this, okay? As you're developing this ossification center, what you're going to start to bring now in is blood vessels, okay? These will grow around the edges of the cartilage and the cells of the perichondrium to convert to osteoblast. Once the blood vessels have started to penetrate into the cartilage, you will then sort of invade the central region. And at that point, you're going to actually start to form some bone matrix. And this will continue, okay? You'll start to form this essentially collar around the bone here, okay? As the diaphysis of the long bone is developing here, and you've developed your medullary cavity, and you have the blood vessels integrated throughout here, and you're starting to develop this compound bone collar. Once this all starts to develop, you will start to develop these secondary ossification sites at either end. And these secondary ossification sites at either end are going to essentially be some stem cells that have now started to develop bone matrix, which will now soon become the epiphyseal ends. This continues much like we saw in the medullary region, where it will grow out and you'll actually fill in with some spongy bone at the epiphyseal ends. What will remain, especially once the developmental years have sort of ceased, but you're not quite, at the age of 21, is, you'll have what's referred to as the epiphyseal line. And this is where bone can continue to grow out, okay? And when you get very rapid activity of this epiphyseal line, this is when you get those growth spurts, okay? Unfortunately, this is a weakened point of the bone too, and sometimes if you end up with a break in a long bone at the epiphyseal line, that's an easy spot to break. And if you do break at the epiphyseal line, the orthopedic has to be very careful because they have to make sure that they realign this properly so that the bone continues to grow correctly. The second type is so essentially the second phase of the endochondral ossification is this interstitial probe. Once the bone has sort of developed, the interstitial growth is the growth in length. And this is from those secondary ossification centers and essentially getting to the epiphyseal closure. This is the completion of the epiphyseal growth. You can actually visualize the epiphyseal line on an X-ray. And as long as that has not closed completely, growth can still occur. And here, if you look, you can sort of see, these, at where you see these arrows, these are all epiphyseal lines, okay? And versus an adult here where they have sort of all but closed up. Also part of this growth is growth in width. This is the thickening and the strengthening of long bones. This is layers of circumferential lamella are added to the outer surface. The deeper layers become replaced by osteons. During this process, Osteoclast slowly removes bone matrix at the inner surface of the bone, enlarging the medullary cavity, and the bone just sort of thickens out. The second type of ossification is intramembranous ossification. And this will actually produce dermal bones, such as the mandible, which is the lower jaw, and the clavicle, which is collarbones. And this actually has 5 main steps, okay? And I don't really get into that one too much, or I don't actually require you to know the actual steps of intramembranous ossification, mainly because you'll see some similarities there with endochondral, but most bones in the body are actually developed by endochondral ossification. Now, blood supply to the bones. Nutrient artery and veins. Most bones are actually quite vascularized, and you will see that they have several arteries and veins passing through them. They will pass through those foramen within a diaphysis. You also have metaphyseal vessels. These are going to supply blood to the epiphyseal cartilage. This is actually very important because this is where bone growth occurs. And then you also have periosteal vessels. These are actually going to sort of filter into the periosteum there, that structure, and supply blood to the superficial osteons and to the secondary ossification centers. And here you can see the different areas of the blood supply throughout bones. But one thing I hope that you actually look at this and realize is that, you know, bone is a very, very highly vascularized tissue. The periosteum will also contain a network of lymphatic vessels and sensory nerves. And, you know, within that periosteum, you essentially have, you know, these important components such as blood vessels, nerves, lymphatics. This is how they're entering into that tissue. Okay, so now I'd like to talk about a concept called bone remodeling. Bone remodeling is something that occurs throughout life. It functions in bone maintenance by recycling and renewing the bone matrix. This is actually going to involve the activity of osteocytes, osteoblasts, and osteoclast. And bone remodeling activity is usually balanced, okay, meaning that any destruction equals replacement. If removal is faster than replacement, that can actually result in the bone weakening. On the other side is if deposition is predominant, this will actually result in the bones strengthening. Exercise, this will actually lead to mineral recycling that allows bones to actually adapt to stress. Heavily stressed bones become thicker and stronger. Exercise, particularly weight-bearing exercise, will actually stimulate the activity of the osteoblast. Bone degeneration. Bone can actually degenerate pretty quickly. Up to 1/3 of bone mass can be lost in a few weeks of inactivity. You know, this is why it's very, very important, especially for older people, especially patients that are in nursing homes, that they just don't lay around. The longer they lay around, the more detrimental it's going to be. The less inactive they become, the more detrimental it's going to be. The best thing they could do is just go for a walk, even if it's for a few minutes here and there. You know, putting those stressors on these bones really, really, really helps to maintain the integrity of the bones. You'll see this similar theme also with muscles when we get to that. Minerals, calcium and phosphorus are required in the diet, plus small amounts of magnesium, fluoride, iron, and manganese. Calcitriol and vitamin D. Calcitriol is made in the kidneys, and calcitriol is essentially for normal calcium and phosphate ion absorption through the digestive tract. This is actually synthesized from vitamin D, okay? And that's why if you notice, if you take calcium supplements, what you will see is that whenever you take calcium, typically you will also have vitamin D supplementing with that. And the reason for that is that to make sure that you are going to be able to properly absorb the calcium into the body. Vitamin C is required for collagen synthesis, and it stimulates osteoblast differentiation. Vitamin A stimulates osteoblast activity, and vitamins K and B12 are required for the synthesis of proteins, specifically those bone proteins. Growth hormone and thyroxine will have effects on bone development. Essentially what growth hormone and thyroxine will do is they will help to thicken up and strengthen the bones. And then we have two hormones, parathyroid hormone and calcitonin. Those two hormones are actually going to maintain calcium homeostasis. The skeleton acts as a calcium reserve. Bones store 99% of the body's calcium, in addition to other minerals. Calcium is the most abundant mineral in the body, and the calcium ions, as I mentioned previously, are vital to many physiological processes throughout the body. It's not just about the bones. The hormones that regulate calcium ion concentration in the body, this is something that is closely monitored to maintain a homeostatic balance. Parathyroid hormone and calcitonin will affect the storage, absorption, and excretion of calcium ions in the bone, where it's stored, the digestive tract, where it ends up being absorbed, and in the kidneys, where it can actually be excreted. And in looking at these two hormones, parathyroid hormone, which is produced by the parathyroid glands, will increase blood calcium ion levels by stimulating the osteoclast activity, increasing the intestinal absorption of calcium by enhancing calcitriol secretion by the kidneys, and decreasing calcium excretion by the kidneys. So it's acting on your existing bone storage of calcium by releasing some of that, increasing the uptake by the GI tract, and also decreasing any calcium excretion by the kidneys. Calcitonin, on the other hand, this will be the opposite. Calcitonin is when you have plenty of calcium. This will actually inhibit the activity of osteoclast, and you will see a decrease in absorption through the GI tract, as well as an increase in the excretion via the kidneys. Damage to bone. These are referred to as fractures. Cracks or breaks in the bone due to physical stress. An open fracture is one that is compounds. It's referred to as a compound fracture, and a closed fracture is one that is referred to as simple. And there are many different types of fractures here. You could have, a transverse fracture, which just kind of breaks across. Displaced, where you're actually physically displaced here. Compression, this is sort of, compressing down or pounding down. Spiral, very common sports injury. This is a little bit of a twist here. Okay. Green stick. Green stick is the most common type of break. With a green stick fracture, this is sort of a crack in the bone. And it's not something that's actually throughout the entire bone. Okay. And I mentioned epiphyseal earlier, and epiphyseal is a break along the epiphyseal plate. Now, bone damage can be repaired. And if you've ever broken a bone, you know that, okay? Fractures are repaired in 4 steps. You will first develop what's called a fracture hematoma. Then you'll develop a callus. You'll replace the spongy bone, and then finally the compact bone. So the fracture hematoma, this is the production of a large blood clot. And if you've broken a bone, you know that you develop this huge blood clot, which involves a lot of swelling and a lot of pain. This purpose of this hematoma is to establish a fibrous network, and bone cells in the area will die. During the callus formation, the cells of the endosteum and periosteum will divide, and they will migrate into the fracture zone. The calluses will stabilize the break. The internal callus will develop in the medullary cavity, and the external callus of the cartilage and bone will surround the break. So here we have our fracture hematoma first, and this is mainly formed because you just broke a lot of blood vessels. Then you sort of develop this callus. This callus, again, the purpose of this callus is really to help support that area that has been broken. Okay. The third and fourth steps of repair is spongy bone formation. This is where osteoblasts replace the central cartilage and the external callus with spongy bone. And the compact bone formation, this is repaired. Bone may be slightly thicker and stronger than normal. So if you've broken bone, instead of just repairing it the way it was, because this is now quote unquote a weak spot, it will probably be sort of reinforced a little thicker than it was originally. This is just to really add a little more support to that area of where it has been damaged. Here we can see the spongy bone formation in the internal callus. Here's the external callus. And then here you have the external callus. You can see it's a little bit of a thickened area there now. When we look at breaks or fractures, sometimes if it is broken into many pieces, those pieces need to be realigned. And sometimes that might involve the use of pins and braces or rods to sort of hold those structures in place until they can form their attachment points again. When you come out of a cast after you've broken a bone, that bone is not completely healed. In fact, bone can take anywhere from 6 to 9 months to fully heal. Most people are in a cast for maybe 2 months, okay? But what has happened within that 2 months is you have allowed essentially the calluses to really form, the internal and the external calluses to really form. And that by itself is, you know, a lot of support that's there for the bone to completely heal up. A fun little story is when I was about 10 years old, I had broken my wrist, fractured it, and I was in a cast for 8 weeks. Progressed pretty well. Was very excited to get the cast off. This was back in the day when we had plaster casts too. So went to the orthopedic. They took the cast off. Everything looked good. I was walking out of the orthopedic office, tripped off the curb, landed in the parking lot. Where else but on my wrist, and walked right back into the orthopedic office and was put into a cast for another 8 weeks. When you come out of those casts, they tell you to be very careful because the broken area is still very weak. And unfortunately, I guess I had to prove that to myself, by actually doing it. Luckily, I didn't do enough damage where I would have required pins or anything. I was able to just get into the cast. The effects of aging on the skeletal system, bones will start to become thinner and weaker with age. Osteopenia, this is the inadequate ossification or reduction of bone mass. This begins between the ages of 30 and 40. Women will lose about 8% of bone mass per decade. Men will lose about 3%. Okay, so women are a little disproportionate here. And it's very important that, females you know, especially during menopause, because it really goes up during menopause when you lose that estrogen support, you know, is very important that they sort of exercise and start calcium supplements and things like that. The epithesis, the vertebrae, and the jaws are most affected. This results in fragile limbs, reduced height, and tooth loss. Osteoporosis is a severe loss of bone mass. It compromises normal function. It's typically seen over the age of 45. 29% of women will experience osteoporosis, 18% of men. Hormones and bone loss are really at play here. In women, osteoporosis accelerates after menopause. And this is just showing you, you know, here's normal spongy bone, you know, and here is osteoporotic spongy bone. So you're just really losing that bone mass, mainly because you have very high osteoclast activity. Cancer and bone loss. Cancerous tissue releases osteoclast activating factor. The cancer tissue, because it's actually activating these osteoclasts, stimulates the osteoclasts, and this produces severe osteoporosis. And sometimes as a result of cancer, you can actually see severe eroding of the bone. Okay, and that is it for chapter 6, going over bone tissue. So it's a little bit of an introduction into bones, what bones are, their functions, and essentially how they develop. Okay. The next 2 chapters are the axial and appendicular skeletons. And for the axial skeleton, I'll probably break this up into 2 recorded lectures. It will be the axial skeleton, which will, the first recorded lecture will be the cranium, the skull, and then the second one will include, you know, the vertebral column and the thoracic cage. Okay. For the appendicular skeleton, I'll probably do upper and lower limbs separately. Okay, so those will be broken up into 2 lectures as well. I will get the axial skeleton up tomorrow, and I'm going to aim for also the appendicular skeleton up tomorrow, but I will definitely have the appendicular skeleton up by the 4th there. Okay. Have a good day, and actually I'll see you guys tonight.